Good evening, everyone. So, I welcome you all to this another YouTube session of topic image based discussion of the oral aspects of some systemic diseases. Oral aspects of some systemic diseases. All of us know it's a very common, very famous saying that oral cavity is a mirror of systemic diseases. All of us know that. So this will be a part one. This session will be a part one where I'll be giving you an overview of some of the important oral manifestations of systemic diseases. Some of the systemic diseases all of us know, like kwashiorkor, marasmus. All of us know about that. They are basically the protein energy malnutrition. They are protein deficiency. Kwashiorkor and marasmus. The most important oral manifestation in this kwashiorkor or marasmus is basically the glossitis, that is inflammation of the tongue, angular cheilitis, and loss of circumoral pigmentation. This is very important. See, around the oral cavity you will see paler area, that is called as loss of circumoral pigmentation. So glossitis, angular cheilitis, and loss of circumoral pigmentation are the important oral manifestations of these kwashiorkor and marasmus. What are these kwashiorkor and marasmus? These are nothing but basically the protein deficiency. Protein deficiency. Okay. Now, we have another important condition known as the Hurler syndrome. All of us know Hurler's syndrome. Okay, Hurler syndrome. What is Hurler syndrome? Hurler syndrome is nothing but mucopolysaccharidosis. Mucopolysaccharidosis. All of us know that mucopolysaccharides. Okay, so if there is a metabolism, abnormal metabolism of these mucopolysaccharides, certain syndromes are seen, like Hurler syndrome, Hunter syndrome, okay, which you have learnt in detail in case of biochemistry. Here, what are we supposed to remember? Here we are supposed to remember that in Hurler syndrome, we basically see very important one, that is macroglossia. Macroglossia. Large tongue. Because these mucopolysaccharides, which are abnormal, they'll get deposited within the tongue. Because of this, the macroglossia, the teeth also will be widely spaced. They will be basically wide spaced. Wide spaced teeth are seen. Wide spaced teeth are seen in case of the Hurler syndrome. So Hurler syndrome is basically a mucopolysaccharidosis type 1, wherein there will be a deficiency of alpha-1 iodouridinase enzyme. Because of this, the mucopolysaccharides will get deposited. Particularly, the important oral manifestation is in the tongue, where this particular mucopolysaccharide will get deposited. That leads to macroglossia, large tongue, and even widely spaced teeth. So these are the important oral manifestations that you can see here. Now moving on to some of the important oral manifestations of some medications. All of us know that certain systemic steroids or inhalation steroids, like in the oral cavity, there are many conditions, dermatological disorders. All of us know, like pemphigus, vesiculobullous lesions, where steroids are given. orally, lichen plus, or inhalational steroids are given. So because of these, the steroids that are given during the treatment, either in the form of inhalation or in the form of the oral steroids, there will be an important adverse effect of candidiasis. There will be important adverse effect of candidiasis. So the candidiasis is seen in the oral cavity. One of the important one of the important adverse effect that is seen due to the administration of steroids. Xerostomia, that is dryness of the mouth, is seen one of the, again, because of the antihypertensive drugs, diuretics, anticholinergics. All these are the drugs which cause xerostomia. Gingival hyperplasia, we can see that gingival hyperplasia, that is because of certain drugs. Very important one, phenytoin. All of us know. Let me make a list. Phenytoin, cyclosporin, nifedipine, erythromycin. These are the 4 important class of drugs which cause this gingival hyperplasia. Gingival hyperplasia or hypertrophy is because of certain drugs such as phenytoin, cyclosporin, nifedipine, erythromycin. Ulcerative stomatitis due to methotrexate. We know that methotrexate, which is an anti-cancer drug, will cause a lot of ulcers in the oral cavity and inflammation of the oral mucosa. That is known as ulcerative stomatitis. And also mucositis. We know that mucositis is an important adverse effect of chemotherapy or radiotherapy. So because of any of the drugs, we are supposed to remember that these are the important adverse effects or the oral manifestations that can be seen. Okay. Now in this part 1, I am going to cover certain topics. Part 2 will be the other we will be seeing. Behçet syndrome. All of us know this is a very important inflammatory disorder. Behçet syndrome, where very important, remember, 100% of the cases of Behçet syndrome will show recurrent aphthous ulcers. So most important criteria for diagnosis of Behçet syndrome is oral ulcers. That too, the oral ulcers, that is the aphthous ulcers. Now there is a criteria here given by a person called as O. Duffy. According to this criteria, 100% of the cases of this O. Duffy criteria is for mainly the Behçet syndrome diagnosis. According to this criteria, 100% of the cases of Behçet syndrome will show recurrent aphthous ulcers. There are other manifestations, of course. Genital ulcers will be seen, conjunctivitis will be seen, skin lesions are seen. Okay, all those are there, but very important for us to remember is 100% of the cases of Behçet syndrome will show oral ulcers. So this is an image characteristically where we can see oral ulcers, conjunctivitis, genital ulcers. Okay, all these are the important manifestations that you see in case of Behçet syndrome. Next, celiac disease. Okay, all of us know that there is a protein, there is a component called as gluten. Okay, gluten in the nowadays that is what gluten free everywhere we are it's marketed like gluten free. So gluten, individuals who are intolerant to gluten will suffer from this celiac disease. We know that the intestine will have certain villi. All of us know that. So due to this celiac disease, that villi will be damaged. So thereby what happens is absorption of the nutrients will be hampered. Resulting in what? There will be extreme weight loss, diarrhea will be, which is a very common manifestation that you see in case of the celiac disease. So this is an overview. You would have learned in detail in medicine that it is what is celiac disease, mainly because of the gluten. But what is the important oral manifestation of the celiac disease? You will see ulcers in the oral cavity which look like aphthous ulcers. So celiac disease, also known as gluten enteropathy, is characterized by ulcers in the oral cavity which typically mimic like aphthous ulcers. So they are aphthous like ulcers that you see in case of gluten enteropathy. Now we have another important systemic disease here called as Crohn's disease. All of us know Crohn's disease is, which is also called as the regional ileitis. Regional ileitis. Basically, it's an inflammatory condition. What simple term? It's an inflammatory condition which affects the ileum. Mainly, it affects the ileum. Okay, so it is basically immunologically mediated. This Crohn's disease is mainly immunological mediated, and it is typically usually seen in young individuals. So we are not going into details of what are the intestinal manifestation, but important oral manifestation. See the image, how it looks like. All of us have seen cobblestone, right? So the oral buccal mucosa becomes like a cobblestone. So that is known as cobblestone appearance of the buccal mucosa. Cobblestone appearance of the buccal mucosa. So in Crohn's disease, you will see cobblestone appearance of the buccal mucosa. Okay, even sometimes we will see ulcers. Remember, those ulcers will be irregular and superficial. Irregular superficial ulcers are seen. Next, moving on to the next systemic condition, that is diabetes. So diabetes, all of us know, will have a very typical oral manifestation. One of the most important oral manifestation is fungal infections that you see in case of diabetes. Diabetes patients, uncontrolled diabetes patients where there is hyperglycemia, so they are more susceptible to develop certain fungal infections. The two important ones are candidiasis and mucormycosis. So in the image there, you can see the first image where you can see the candidiasis, that is white patches. White patches can be seen there. Candidiasis, that is due to the Candida albicans. And even also you will see one more fungal infection, that is mucormycosis. Mucormycosis is a fungal infection typically affecting the palate. You can see that image, typically affecting the palate and the nasal region in uncontrolled diabetes mellitus patients. Other than these, diabetes patients are more susceptible to develop gingivitis and periodontal disease because their immunity or the immune threshold is reduced. So they are more susceptible to develop inflammatory conditions such as gingivitis and periodontitis. Moving on to next systemic condition, that is Addison's disease. All of us know Addison's disease. What is Addison's disease? Because of corticosteroid insufficiency. If corticosteroid levels are increased, that is called as Cushing syndrome. If corticosteroid level is reduced, that is called as Addison's disease. Now, whenever there is Addison's disease, there will be excess of melanin pigmentation. And those melanin pigmentation are typically seen around the oral cavity, particularly around the oral cavity. That is known as perioral pigmentation. So in the first image, you can see particularly the lips and the oral cavity, you will see the perioral pigmentation. Now we are talking about the oral manifestation. There is a doubt like in the Crohn's syndrome, cobblestone is seen in intestine or oral mucosa. We are talking about oral mucosa. So the cobblestone appearance is the typical oral manifestation of Crohn's syndrome. Okay, basically you see the oral manifestation. That's oral manifestation. So Addison's disease is another very important condition where you will see perioral pigmentation. Perioral pigmentation. Even you can see the pigmentation in the oral cavity, but around the oral cavity pigmentation is very important. Hyperpituitarism. Hyperpituitarism, where we know that excess of growth hormone. So in this condition, very important one is about the jawbones. All of us know there will be the basically macrognathia, larger jaw, particularly the mandible will be larger, prognathic mandible will be seen. And one other important oral manifestation is macroglossia. So tongue also will be very large in the patients of hyperpituitarism. So the two important oral manifestation that we are supposed to remember in hyperpituitarism is the macrognathia, that to the mandible mainly, and also there will be macroglossia. There will be macroglossia. Okay, moving on to anemia. So in the anemia, all of us know basically there will be glossitis in any anemia particularly, and this glossitis is mainly because of the loss of the papillae. Mainly the papillae is filiform papillae and to some extent fungiform papillae. Remember, the most important papillae that is lost in anemia is basically the filiform papillae. Iron deficiency anemia, if you see, classically you will see angular cheilitis. There is no other typical oral manifestation. Glossitis is seen, pale oral mucosa, angular cheilitis, all those are seen. Okay, but in pernicious anemia, you will see something called as beefy red tongue. Beefy red tongue. What is that beefy red tongue as? The beefy red tongue is known as Hunter's glossitis. All of us know that the pernicious anemia, which is because of vitamin B12 deficiency. Actually, it is not vitamin B12 deficiency. Pernicious anemia occurs because of autoimmune destruction of intrinsic factor. All of us know that there is something called as intrinsic factor, which is responsible for the absorption of the vitamin B12. Now, pernicious anemia is an autoimmune condition where there will be destruction of this intrinsic factor. Thereby, vitamin B12 is not absorbed. So, the important oral manifestation that you see in this pernicious anemia is beefy red tongue, which is also known as Hunter's or Moyler's glossitis. Hunter's or Moyler's glossitis. Okay, there are many other type of glossitis, like I will be discussing that in case of the pellagra. There is called as bald tongue of sandwich. There is one more important condition called as bald tongue of sandwich. What exactly is this bald tongue of sandwich? It is because of the pellagra, niacin deficient. Pellagra, mainly because of vitamin deficiency, pellagra, where you will see this. Not niacin, pellagra, where you will see the basically the manifestation same typical like your pernicious. Okay, so vitamin deficiency, this beriberi, there is thiamine deficiency, pellagra due to niacin deficiency, scurvy, vitamin C deficiency. All these we will see later. Okay, second part we will see, and in the second part we will also see some other conditions, systemic conditions like blood disorders where oral manifestation is important, like infectious mononucleosis. All we'll see in second part. So here, just to mention that bald tongue of sandwich is because of the is seen in pellagra. Granulocytosis. All of us know that granulocytes, particularly the neutrophils, are very important. So whenever there is any agranulocytosis, particularly the more circulating neutrophils are reduced, there will be necrotizing ulcers in the oral cavity. Ulcers are seen, but they are necrotizing ulcers. And there will be excessive destruction of the supporting tissue, that is a periodontal tissue. Excessive destruction is seen, and you will see regional lymphadenopathy. All that regional lymphadenopathy obviously is because of these basically the infection. So inflammation or infection, so secondary infection will lead to regional lymph. But important in granulocytosis are seen are oral ulcers, particularly the gingival ulcers. More specifically, you will see gingival ulcers and necrotizing ulcers in the oral cavity. Necrotizing ulcers in the oral cavity. Okay. Now, there are other certain important oral manifestation like cyclic neutropenia. All of us know that there is something called a cyclic neutropenia. So, what is cyclic neutropenia? For about 4 to 5 days, that's a period where the neutrophil level will reduce, again it increases, reduce, increases. This is a cyclical condition. So cyclic neutropenia. There also the gingival ulcers are very important. They are the most important oral manifestations. Okay. Now, and those ulcers, we have to remember, very important one, how to identify that these are one of the important clinical clue that we'll get is they are very painful. They are very painful and they are crater-like ulcers. Where do you see crater-like ulcer in the oral cavity? This word crater-like ulcer is basically definitely there are some questions have been this definitely please I'll definitely go through. Please retag me. If you don't mind, please retag any other questions. I will definitely solve whatever are your doubts. Please retag. By tomorrow all your doubts will be cleared. Okay. Now, so cyclic neutropenia, important thing what I'm supposed to tell here is the gingival ulcers. And remember, those ulcers are basically very painful. They are crater-like ulcer. Whenever we hear of the term crater-like ulcer on the palate, what should come to our mind? Necrotizing xylometaplasia. All of us know that there is a condition called as necrotizing xylometaplasia. So that necrotizing xylometaplasia also will show crater-like ulcer. But what is the location? There it is on the palate. Here in cyclic neutropenia, you will see gingival ulcers and that too crater-like ulcers. Crater-like ulcers. Okay. Now that is about the first part of the oral manifestations of systemic diseases. We'll have another part probably after a few days where you will see the other part, that is about the vitamin deficiencies, most important one, and you will also see about certain hormones like hyperparathyroidism is very important one, where we are going to discuss some of the important oral manifestations, and certain important blood conditions like leukemia. We are going to see about the infectious mononucleosis. Okay, that will be, you will see in the second part. Okay, so I hope this part is very clear about the oral manifestations of systemic diseases. Okay, thank you so much.